A very common statement that most of my acne patients keep telling me is that they've gone to so many different doctors, and when you take the medicine you feel better and the acne goes down, and the moment you stop the medicine it comes up again. Well, the simple answer to that statement is obviously yes. If you are born with an oily acne prone skin, now each of us we are born with different types of skin. Some have very dry scaly skin, some have oily skin, some have normal skin, and some have oily and acne prone skin. So obviously, if God doesn't bless everyone in the same way, if you have a great height, you might be blessed in 99% different ways. But if you have an oily acne prone skin, you will always, due to different reasons and circumstances, you will get more acne compared to a person who has a normal skin. Let's say, for example, I have a normal skin and my friend has an oily acne prone skin. So when both of us get our period, I will get 2-3 pimples. Of course, any girl would get some pimples during their menstruation. But the person who has oily acne prone skin will get more pimples. If both of us have a chocolate, an entire bar of chocolate, I will get more pimples, like let's say 2 or 3, because obviously for most people when they consume lots of chocolate, you get acne. And the person who has oily acne prone skin will get more acne. Same with the junk food. If we break rest or if we are stressed out, the person who has normal skin, obviously because of stress, will get some acne. But if you have an oily acne prone skin, they will get more acne for sure. So you need to understand that you're stuck with oily acne prone skin for life. If you want to have a normal skin, what should you do? So if you want to have a controlled acne-free skin, then you need to have a proper acne controlling and oil controlling skincare routine. You have to use an acne oil controlling cleanser depending on your skin type. Different people respond to different products. I usually suggest more medical grade products than more cosmetic products. If your skin is really good, you can use the cosmetic range, but if you have a problem skin, it's highly recommended to take something on a doctor's prescription, which is more medicinal. Then you have to use an oil controlling moisturizer morning and night, not a hydrating moisturizer. Now you're producing enough oil, so you have to use an oil suppressing or oil controlling moisturizer. And when you get pimples, obviously on a doctor's prescription, depending on what suits you the best, you have to use spot creams to maintain or reduce the individual pimples that you may get. Having a good skincare routine is very, very important. And just because your acne is gone doesn't mean that you need to stop it. You have to continue the skincare routine in order to maintain an acne-free skin. Number 2, your diet is absolutely 50% of your treatment. So if you are consuming a lot of chocolate, a lot of dairy products, which contains cow's milk, if you consume a lot of junk food, coffee, cashew nuts, peanuts, and all sorts of unhealthy things, there is no point having a perfect skincare routine. You're obviously going to get more acne. So skincare routine, proper diet. Have lots of water, have lots of healthy food. Number 3, your hormones have to be regular, which means if you're a female, you have to make sure you get your period. If you're not getting it on time, please seek medical advice. Number 4, your hygiene. Now, most of us are used to using a lot of makeup products, foundation, and sometimes, you just use the same powder, same sponge, morning and night, every day, and we just close it, keep it away. All the bacteria on our face gets onto that product, we close it and keep it away, and the next day morning, we rub it on our face again. So it's important that you wash your brushes, wash your sponges, and always use clean skincare makeup. Use a new towel, at least change your towel, wash it and change it every 2 to 3 days. Use a washed pillowcase every 2 to 3 days. Keep your scalp free from dandruff, basic things like that. The biggest disaster nowadays is when people use lots of bleach cream, which has no names, or very famous skin fairness bleach creams. We often get many people who come with acne maybe immediately, or after using it for a few years they get acne. So this type of skin is so difficult to repair because their skin is already burned, it's already unhealthy, so it takes a very long time to repair the skin. So please be mindful of the skincare products you put on your face, because if you give good things will come out of it, and if you give it bad things, your body will reject it. So as doctors, how we improve acne is, as cosmetic physicians, we would give you a diet, a proper skincare routine. We will do some skincare treatments, medicated treatments such as chemical peels, laser. They're so common and so famous nowadays. Some people are just worried, but it's very safe. It's done by all the dermatologists and cosmetic physicians now. And we also will help you with regulating your hormones, teach you a proper healthy lifestyle in order to get your skin up to 100%.